What I am excited about as a distinguished professor of health equity research here in urology is to see the beautiful things that happen around me every day at work. People getting access to PSMA PET scans and genetic testing and genetic counseling. Um, Having these PSMA PET scans and prostate MRIs impact the decisions that their clinicians are making, and they can actually visualize it for themselves on the screens in our clinic, so they understand why they are choosing this. And I can give them biomarkers because I know how it works in their race to even predict whether they should get a biopsy or not. Um, that kind of precision oncology, I would love to see that happen all over the place. I worked at Jesse Brown VA, I worked at Cook County Health, and I've worked as a locum tenens doctor in lots of places that do not have prostate MRI capability or fellowship trained radiologists. I work in places who have biomarkers that have never been validated in Black patients that they serve. And so what I hope to have happen in the urologic field as a whole is that we recognize the impact of capitalism on these biomarkers and these imaging studies. They're pushed out and they're out there to be used, but they oftentimes are not validated for accuracy in large minority groups. If you added Black and Hispanics together, that's 30% of the country right there. And most of these biomarkers have never been validated in those groups. And if you start adding in, Asians and the others, that's 40% of the country that are using these tests, but they haven't been proven to be as accurate. And so you're sending patients home and we're not quite sure that we're doing the right thing all the time. We're guessing. And so I hope that we can convince people that when you develop an assay and you recruit the patient population to prove that it works, that you think about the sites that need to be at the table to recruit adequate numbers of Blacks, Asians, Hispanics, and whites, old and young, poor and well-off, rural and urban, so that we know that these things work for everybody. They're usually funded by public dollars, by the way, through taxes, and so all of us should be benefiting.